Hi, everybody. It is February 1st, 2021. We want to get to the very latest coronavirus numbers as they pertain to the state of Arizona. Do have a lot of changes to talk about today. We'll get through all those with you and hopefully answer any questions that you might have. Lots of stuff to get to. And there is more hopeful news in some of these numbers, which is always good, Garrett. I want to let everybody know we will be talking about vaccines, some big updates on the number of vaccines that have been given since we spoke with you last, and we won't miss that part. So just want to let everybody know to stick around for that. When we talk about our numbers, though, Garrett, they're falling pretty fast, and that's a good thing.
Yes, our numbers seem to be falling about 20 to 30% right now. It's pretty incredible. The number of new cases reported today, 3,741. Number of new deaths reported, 4. Now, we've talked about this before, especially with the death reporting. Because it is a Monday, we're likely to see a much higher number tomorrow. However, we, as is going to be a continual theme throughout this broadcast, we seem to be turning the corner here. So our 7-day case average with that 3741, when we smooth that out with the others, our case average is now 4892, just under 5,000. And Arizona has not had a case average under 5,000 since December 4th. And that's a very important metric, because although our death numbers, our death rolling average is still 126, it's still over 100. It is the lowest it's been since, that one moves a lot more. It's January 20th. But we are, because our case numbers are going down, we should start to expect to see this number go down as well pretty quickly. And we're seeing this also in the hospital metrics. We can get to all that as well. But basically, the theme right now is everything's going down. And I know some people will see this number of diagnostic test. It's a very small number, 10,000. And that is correct. That is a very small number. However, as far as a rolling average of number of tests that we're doing, we are still doing a tremendous amount of testing. We're still sort of on a high with that number, and our percent positivity rate is also going down. So it's not just the number of tests that are being conducted that is contributing to the lower number of cases we have. We also do have recordings of lower positivity rates.
And this affects our active cases too. So we don't have exactly a number for recovered cases because everybody's recovery is different. But the active cases that we're seeing in Arizona, we were seeing active cases over 200,000 people. And I noticed that number dropping quite a bit.
Yes, we're at right now the active case range. We have about 72,000 cases in Arizona that are under 14 days old. So these are the most infectious cases. It is very highly likely that those 72,000 people are infectious because the disease is under 14 days. We have 184,000 in Arizona that are under 27 days old. While some of those may still be infectious after 14 days, the likelihood drops off pretty significantly, but that is the number that we have to basically, when you look at the CDC's estimates, they say 27 days is pretty much the cutoff point for the vast majority of cases. If a case doesn't end in a deceased at that point, then it can be considered recovered. So about 184,000 people in Arizona that are in that category. And as you said, only a couple days ago, those were about 200,000.
Yeah. We are going to report death threats to the police if those are happening in the comments. Just so you know, Orlando, I'm seeing your comment there. We will report death threats to the police. So please stop. We are going to block any comments that continue like this. We are doing our job here today. Can we move on to the hospitalization numbers too, Garrett, which are down by 30%. This is good news that we're reporting here, folks.
Yeah. All you guys in the comments that are talking about us doing fear mongering and whatnot, we're literally talking about things that are happening that are good right now. So,
and we have families.
If you're not going to pay attention, then just get off the broadcast, please.
Please.
So, thank you very much. So anyway, back to reality. We go to where was it? It's right here. Okay. So we're going to go to hospitalizations here. And this hospital, we're going to look at these hospitalizations. First, we're going to start at ICU. Now, ICU numbers, we expect these numbers to not fall as quickly as hospitalizations or cases, because unfortunately with ICU, these are the longest, most severe cases. So when we see this, we expect it to be it has fallen. It's fallen by about 20 or 30%. From its high of 1,183 COVID-19 patients to about 984, just under 1,000. You can see that the hospitals are keeping the headroom at about 90%. We have seen this to be, as you can see throughout this entire pandemic, they've let it go down. In October, it was down in 80, what is that, 88%.
Mm-hmm.
But they try to keep that number, or 78%. They try to keep that number as high as possible because they have a lot of hospitalizations to go through of people that are waiting when the COVID-19 hospitalizations get high.
Yeah, because there's other people who have put off care,
Yes.
or they weren't able to do elective surgeries at that time, and they're able to welcome some of those folks back in and provide the care that they need as well.
Yeah, exactly. And here's the inpatient numbers, and you can see we've had a pretty dramatic fall in the inpatient numbers. Let me get the actual number here for a second. I've got that on a. Oh, sorry about that. I didn't mean to move that up. 30%. Yeah, the inpatient is a 30% fall, and that's from. But you can see the headroom here again, staying in that sort of mid 90s, lower 90s, high 80s sort of number. They're keeping the headroom up. Emergency room.
The emergency room storyline is very interesting because I know there's a lot of noise in those numbers, and they're not as easy to track. We sort of have to smooth out the lines, but it's a hopeful story here as well.
Sure. Yeah, exactly. So this is what the actual just all emergency room looks like in Arizona. It has nothing to do with COVID-19. And you can see that's fallen pretty dramatically since the 25th. It was up at 56%, and now it's at 50%. But what you're talking about, Katie, I'm going to go right to that because it's such a conversation starter, if you will. Here we were on the 25th let me see if we can get to it. The 25th here was, I'm just missing it, about 1,900. 1,900 people were visiting the emergency room around the 25th, about a week. Now it's down to 1,480. We're down quite literally 25% in just a couple of days for emergency room department. So this is COVID-19 emergency room visits, and you can see they've just gone down. They've plummeted really in the last week. And we're seeing that all over the place with discharges as well. This is something that's going to help us determine. We've talked about how discharges can also be part of the death numbers, but now we're seeing lower discharge numbers. So again, we should be expecting to see lower death numbers to follow with these lower discharge numbers. So, and our intubations as well. These are all metrics that basically push our death numbers. We kind of can figure out what our death numbers are going to be looking at these numbers. And even our intubations are down. They're not down a lot, but they're still down. So, we're looking at, again, pretty good numbers here as far as our hospitalizations are concerned for COVID-19.
So when we look at these ER visits, we always kind of track that as a leading indicator. So maybe if someone even hasn't tested yet, but is feeling symptoms and heading over to the hospital, this can't be stressed enough that this is such a positive sign. And also, Garrett, usually when we see changes in numbers, there could be something else to attribute that to. Like when we see the number of discharges, those sadly could be deaths, not just people getting better and leaving the hospital. Right. When we look at ER emergency room visits, is there any other reason for those numbers to drop, but that this is better news?
So what I would say to that is typically with emergency room department numbers, when we see them give us sort of an anomaly in the data, it's because of reporting issues. And usually it either changes the direction or it's the same day. So for example, if we look at sometimes you'll see something where there's either very little change or no change in these numbers, and that could be a reporting issue. But to have a pretty sustained drop in the numbers right now, I mean, and you can see if you look at the numbers back in the summer, we had a similar drop, and so that because I see sort of that pattern reflected in our last surge, where we had a sustained drop from about 1,800 to about 1,300 in just this very quick period of time, makes me sort of think that this number is not a reporting anomaly, and it is in fact a drop in COVID-19 emergency room visits.
Okay. So we'll continue to track that news. The other thing that everybody was talking about was, and I just want to remind everybody, we see the case numbers climb and peak and plateau. Then we see the hospitalizations obviously climb, peak and plateau, and hopefully they're on their way down with those hopeful numbers. The last metric and the saddest one, the hardest one to deal with, is obviously the loss of life. We're still sort of in it for those numbers.
We are starting to see the end of that number as well. We're finally at the point where we're going to start. We were at about 150 was the average last week. We're now at 125, and there's a good chance
a day, Garrett. 125 a day.
Average on average.
Okay.
And we're at 125 right now, and there's a good likelihood that we could be if we have this conversation again next Monday or Tuesday, we could be at either 100 or just under 100 at that point.
That would be a very good news. There was a startling statistic that came out last week that caught all of our attention. 10% or nearly 10% of all death in Arizona with the COVID-19 diagnosis happened within the last week. That's a huge number. We knew that this part of the virus was going to be very difficult, but that's huge. When we're seeing those jumps from 12,000 to 13,000, and it's happening just within a week's time span, it really illustrates what we've been through this past year.
Yes, unfortunately, our hospitalizations, our ICU numbers were very high, and we unfortunately we've known from this pandemic from the beginning that when someone goes into an ICU, when it is bad enough that you have to go into ICU, really the chances of survival are anywhere from 30 to 60% at that point. It's ranged depending on how much how full the ICU is and some other factors, but it's you're talking about, 1 in 3 chance, 1 in 4 chance, 1 in 5 chance at that point, and sometimes even 1 in 2 chance. So it's when you get to that point when it's that serious, it's a problem. And so that's why we want to see, as far as those death numbers, we want to see the ICU numbers drop as quickly as possible, because as those numbers drop, they will, we will see our death numbers drop as precipitously.
I feel like Andrea's reading my mind, because this is exactly what we're going to talk about. And actually, I think it was before Garrett and I started this broadcast today, we were talking, we have to talk about RT Live, that website. Yes, and I said, somebody asked us about it over the weekend. And now I'm remembering it was Andrea who asked us. So we do want to explain what's happened to that and where it's going, and then teach you all where to find that. It's not going to be a site that's as pretty or as easy to read, but we know so many of you have been with us on here for a long time. So we'll guide you through that. So let's talk about that. And Andrea, that's not the only one. That's not the only site that we're losing. So we'll talk about the other site that's going to go away and why.
Yeah,
so
it's a lot of changes coming to sort of COVID-19 reporting next year. So we will go through this first. So RT.live. Obviously, I am right now on RT.live. This is the site that comes up if you put in RT.live. They have finished their tracking. They will no longer give us the rate of reproducibility any longer. So at this point, unfortunately, we can no longer use RT or their calculations in order to give you what's going on. There are some sites. In fact, this Epi forecast is one that we're going to go to. It's not as pretty. And it's a different calculation, but it still gives us about the same data. So you can see right here, what we're looking is the effective reproduction number. That is the RT, how it is put on this site. And you can see the highest in the country is 0.94. So no state in the country is
over that 1.
No site is higher than 1 anymore. And we are the third at 0.88. And I've seen a couple other RT calculations that have us at about 0.88 as well. So it seems that that's about where we are. You can see our error bars. We're just at 1 in our error bar, 0.7 to 1. And that's where we are right now. So let me give that to producer Carrie.
Okay.
We can have
so that we can make sure to pass that along. For anybody that has not been on that RT Live site that we were talking about, as Deborah writes, I missed that site. It was so easy. It was so easy. And it showed a green section, meaning you were under 1, and a red section, meaning you were over 1. That red would be you're spreading rapidly, and green would be that you're starting to get things under control. So obviously it was prettier, it was easier to read. Deborah's right in all that, but hopefully this will be a good second place to go to as soon as RT Live is gone, and the next site we're talking about will be gone in March. So let's go on to that and explain. And you highlighted Arizona's number. What was Arizona's overall number?
Arizona's 0.88.
0.88. All right. So just so everybody can note that, in a much better shape than we were before. So the other site that we're sadly losing is going to be the COVID tracking project. That is actually going away on March 7th. What's happening there, Garrett?
This one's a big one. So let me go to COVID tracking project. I really can't say enough about what this group of people at the Atlantic have done for data analysts and other people for the COVID-19 pandemic as far as trying to track this. So COVID tracking project was put together back in, I want to say March or April of last year. And they basically they did the state-by-state reporting that the federal government wasn't set up to do at the time. And so they captured all of the data on not just the cases, but the hospital, even data that even John Hopkins wasn't capturing at the time. Hospitalizations, recoveries, testing numbers, different testing numbers, a whole bunch of stuff that was not being captured by any other source at the time. And so they were the COVID-19 source of record for quite some time. But they put out a post today saying that they are going to basically stop service and stop tracking on March 7th. And the reasoning they gave for that is because at this point, Health and Human Services, CDC, and all of these other organizations, John Hopkins, all these others are now basically, they filled in. They finally caught up to what COVID tracking was doing. And because of just the way that reporting works, it's so much easier for the Health and Human Services to capture this data. Whereas, a COVID tracking project was not only operating off of just a staff doing this, but also tons and tons of programming scripts to make this work. So if anything changed on any state level data set, they'd have to go back and reprogram it and all this other nonsense. But now they can just rely on Health and Human Services that gets reports directly from the health departments for the same data. So they just made the decision that March 7th they would stop reporting.
It sounds like it wasn't an easy decision for them. It sounds like they went back and forth quite a bit.
It does. When you read their Twitter and their blog posts about it, this was something they didn't come to this decision lightly. But they just have to move on at this point. And because they felt that the service that they provided early on in the pandemic
was crucial.
It was crucial, and they did their job. But now that the Health and Human Services and CDC are both caught up, there's so many places that no longer have to rely on them. I mean, if you looked at websites or any sort of tracking that was being done back in the summertime, if you look for the source data, it was almost always COVID tracking project.
Yeah, for sure. For sure.
Now it doesn't have to be. Now it's back to Health and Human Services, CDC, or any of those data points, because they're caught up with the hospitalizations. They're caught up with all this other data that the COVID tracking project was doing. So we know I didn't really rely on COVID tracking. I did early on. Don't get me wrong. And once we started to do our own sort of scraping of the website, we got more data that was more accurate than what even COVID tracking had, because we were no longer just doing the reported numbers, we were doing the epi numbers. And once we got to that point, we didn't need them as much anymore. But we can't, one of the things that they were best at is not just for single shot looking at just one state at a time, but also comparing states across the board with each other. And that's something that I can't use epi data for, because I don't have epi data for California, for Utah, for whoever. I don't have that epi data, so I can't use my epi data to compare with theirs. So COVID tracking gave that sort of ability to compare state to state. And again, now you can do that at Health and Human Services or CDC, so you don't really need it anymore.
So we can spend a little more time at a future date going over that site once this is officially shut down, if you guys are interested in it. Also, if you guys are on any sites that you love that are tracking these numbers and you find that they're stopping their services, find us on Twitter, find us on Facebook, let us know, and we'll do what we just did here, and that is to help you find other sites that are comparable to what your favorite site has provided. Likely they're not going to be as pretty like this one when we had a really colorful one and then it just went to kind of like a boring one sheet, but at least we can still continue to get you the information that you've relied upon for these months, and hopefully that helps. Okay, Garrett, we're getting so many questions about vaccines, and I want to make sure that we talk about this. So we have 7.8% of the U.S. has been vaccinated at this point. When we drill down to those exact numbers, 5.8 million have had their entire series here in the US. 26 million have had their first dose. So that's kind of where those numbers break down. As far as Arizona, 659,000 doses have been given out. We have 101,000 Arizonans that have their complete set done already. We have 1 million doses total on order. So those are all the numbers. And the one thing I want to stress in all this, Garrett, is we had some big changes to the counties since we last met with everybody. We have counties that are now accepting people over 65. This does not include Maricopa County. Remember, if you're trying to schedule at one of the county sites, you've got to be in those specialized groups or over 75. Here's why, here's the counties that are accepting 65 and older. The list is growing. Apache, Cochise, Coconino, Graham, Greenlee, Navajo, Yavapai, and Yuma. So if you're over 65, you can go to one of those county sites. Again, Maricopa is not in there. Oh, I missed the question that just came up. If producer Carrie can put it back up. Can you tell me why people over 65 have to go to a state site? Okay, the state is the only one with that allotment. That's why. That'll change. So don't think that you have to go there. You just, if you want to get your shot now, you have to go there. They are all filled through February. If you want to go to someplace closer to your house, you can wait for your county site, or as I mentioned, that long list, your county is ready for you. So Sharon, if you're in Apache, Cochise, Coconino, Graham, Greenlee, Navajo, Yavapai, or Yuma, you can start going to the county site. So this is only for those that are not with that shaded line. See, I don't know if you can all read this on your phones, but the ones with the,
I was trying, someone was complaining about my volume, so I was trying to
adjust it
on my microphone while we were talking, so I do apologize.
No worries.
Yeah. let me show this a little closer as you were talking about. So yeah, we do have a lot more patterns indicate counties vaccinating 65 and older. So as you said, Yuma, Yavapai, Coconino, Navajo, Apache, Cochise, Graham, and Greenlee are the counties that are 65 and older at this point.
So yeah, so Brenda's asking, Katie, was Pima on that 65 and older list? They are not yet. So think of it as like some of the bigger population-wise counties. They're having to get through so many more people. So that's why you're not seeing Pima and Maricopa on that list just yet. Hopefully very soon, but also keep in mind that a lot of those vaccination sites are full. Now this complete list is also on the AZDHS site. It's a little harder to find. If you can't find any of it there, send me a message on Facebook and we can find that for you. We talked about all those in priority 1B, and then we do have some counties fully in 1B, and you're seeing them listed there: La Paz, Apache, Navajo, and Santa Cruz. So hopefully that helps for your scheduling purposes. We know that many of those sites are very, very full. In fact, the state-run sites are at least full through January and February, both at State Farm Stadium and Phoenix Muni. At this point, they are 100% full. So just some things of note. I want to see if there were any other questions in there that we can quickly get to. Garrett, let me know if you see any of those. But about that.
Oh, sorry, go ahead.
I was just going to say about that second dose, you can get your shot, pull right through, and then they'll set you up for the second dose at those state-run sites. So we got a lot of questions about that last week, and I want to make sure that you guys got that information passed along too. So we're making our way through the numbers. It's a little better.
So this is what I have. I have a friend of mine, on an acquaintance who does this, does vaccine tracking as well on Twitter. Mentalplex is the Twitter handle here, puts out a graph of basically the trajectory lines of where it appears we're going for vaccine distribution. It does appear that we should be around 1 million vaccines administered, the first dose, anywhere from next week to the 16th. So that's sort of the areas we're looking at as far as being able to get to that million dose here.
Million dose mark. All right.
We're getting close.
Yeah. So let's see. Anita writes, a friend of mine got an appointment for himself and his son to get a COVID vaccination. His son, a triple paraplegic. He's only available 5 hours a day. They waited. They couldn't make it to the front of the line. Is there someplace they can go to get a vaccination? Friend in his 70s. It depends if he's over 75 at this point. So Anita, if he's over 75, he can go to any of those sites. If he's not over 75, he would have to book with the state, and the states are all full at this point. So as soon as they get more and they open that up again, we'll pass that along to let you know. And then the gentleman in his 40s, that just depends on his setting where he's living. So if he's in a congregate care setting, that would bump him up in the line. If not, he's got a little bit more time to wait, just based on the where he lives. So hopefully that helps. Let's see. How do I get an appointment for the second vaccine I've been trying since 121? So I'm assuming you went to a state site, and if you did, they are going to email you if you got your vaccination before 121, which I'm assuming you did. So you'll want to check your email, and if you're not responding to your email, they're going to make a phone call to you.
Check
your
spam too, because a lot of times those emails.
Yeah.
Check your spam filter.
Yes. So yeah, she's writing, I'm 83. I need that second dose. Every number I call, they won't register. I can't reach on computer. So they're probably, if you haven't gotten to that 3-week mark yet, don't worry just yet, because they're going to be sending you an email. And the other thing to note in all this, you don't have to get your shot exactly on 3 days. Any point after the 3-week mark is good. Obviously, you want to get it as soon as you can, but just watch that email and make sure you go past that 3 weeks for that email, and then we'll talk again and start to get a little more concerned and active in getting you an appointment. Andrea is asking, do you have any idea when there will be more appointments? We don't at this point. As soon as we hear, we're going to let you guys know right here. And I've been posting on my Facebook page as well. So hopefully that helps to get you the information. Any county for 1C? Not yet. Not yet, Kathy. Kathy's been so patient. She's been joining us on here. As soon as we hear Kathy, we'll let you know. But haven't heard of any of the 15 counties getting close to that just yet. Yes, it looks like, Deborah, they are giving Pfizer over at the Phoenix Muni site as well. And we should stress that Phoenix Muni did open this morning. And so they are open for shots. Remember, you have to have an appointment. I know that we're saying this all the time, and it seems repetitive to so many of you who are like, I know, of course I have to have an appointment, but you'd be surprised. People have been driving over there and showing up, and they're like, you don't have your QR code or you don't have your number, you got to turn around, because it's just for those who have registered already. Okay, we can get back to the vaccines if there are any more questions in a little bit. People have been talking recently about the differences in, Garrett, the response here in Arizona versus Washington State. We kind of have the same population as Washington State. They've handled it a bit differently. They're starting to open up schools again there. They have had 4,285 deaths compared to our 13,000. They have about the same number of people who live there. Remember, this is an area that was hit hard early on when they had those early cases. Now, granted, we had an early case here in Arizona as well, but they had that outbreak at a senior care facility when we were just beginning to learn what COVID was all about and how to respond and who it affected more. So it's interesting to watch those numbers there in Washington State, Garrett, and see how different responses have panned out.
Yeah, I'm actually gonna let's go to this was one of the sites I was gonna share today. It's the Carnegie Mellon site. I don't use it that often, but I'm gonna start using it, especially since COVID tracking is not available anymore. So this site uses not just the COVID data itself, but it also has a partnership with Facebook, in which I'm sure all of you that are on Facebook have seen those surveys that they every once in a while they'll do a survey asking you about what's going on with COVID-19, if you've had it in your house, what your habits or your behaviors have been, and this is one of the data, basically the data aggregators, someone who's taking that data from Facebook and actually doing something with it. So right now I have up here Arizona, and this is people wearing masks. Let me just make sure I've got Arizona up. Yes, Arizona. People wearing masks. You can see that. Hold on a second. I don't think this is right. Let me just check this. Yeah, sorry, that wasn't right. I was like, no, we're up in the 90s. So you can see our mask wearing in Arizona is about 94%. So let's go to Washington. We're going to add Washington to this and see what we compare to with Washington. You can see that Washington's rate of mask wearing is about 90. What is it here? 96%. So they're at about 96%. We're at about 94%. So only 2% on that. So let's look at a couple other things. Let's look at a way of location for the last 6 hours. Hold on. Come on. You can change.
This is fascinating, Garrett. This is so interesting.
So we are in, by the way, Arizona's in gray, Washington's in blue. So you can see, for the most part, in all of October to now, we have been in Arizona more mobile than people in Washington for at least being away 6 hours. Now let's talk about grocery stores. Let's move to that. So let's go to 3 to 6 hours. Oh, that's the one I actually picked on first. I'm sorry. Okay, so actually they're both exactly the same. So bar visits, let's talk about bar visits. You can see this one, they're quite low anyway, but you can see ours sort of fluctuate a lot more than theirs does. Theirs is, again, they're in blue. We're in gray. They just started around 1227. We do fluctuate a bit more than they do there. Restaurant visits, we're going to see basically a tremendous difference in restaurant visits. Our restaurant visits in Arizona are much higher than what you're seeing in Washington. Let's go to doctor visits. as soon as it loads here. I know sometimes, I mean, they're doing a lot of data here. You can see
Yeah.
our doctor visits while we have followed a very similar pattern in our data lines, you can see for the most part, our data they've been significantly less percentage of COVID related doctor visits have come from there. So in most of these metrics, you can see that Washington has had, as we've talked about, less numbers than we have. So, and this is where you're talking about with the deaths here, newly reported COVID-19 deaths per 1,000. When we put this against Washington, as soon as it shows up, you can see for the most part, we were about the same. And then around December 4th, it started to change pretty dramatically. And this is what we've been seeing. So.
Yeah, this is a super interesting comparison. So you really could type in any state and make this map as busy as you'd like it to be.
Yeah, I was doing California before. While I was prepping for the show, I was using California just because we're so close to each other on the differences here. It does, like I said, take a little bit of time to get everything here, but here you go. You can see California now is in the light gray. Oh, they got to choose some better colors there. And Arizona's in the dark gray. So Arizona's up here, California's in the middle, and Washington's right there. Let's look, all of these, it pretty much shows very similar numbers everywhere. So if we go to restaurant visits, this one's interesting because you can see that while Arizona or California has had a higher case count than Washington, their restaurant visits have been fairly low, unlike ours. Ours were much higher than theirs. But as far as like away from location, California is sort of in the middle ground of both Washington and Arizona. You can see it's kind of right there in the middle. At some point, there's been a few times where they've matched Arizona in mobility, and sometimes they've matched Washington in their mobility. So this is what we're seeing here. So.
Yeah, and Kristen's bringing up an interesting point. I haven't looked at this site in a long time, Kristen. The data that was shared with the smart thermometers. Now, obviously, everybody doesn't have one of those, but as a way to gauge health across the country, it was something interesting, especially early on in this, to see where that data was coming back. Where they were getting a higher reading, or there was more concern of spread. And there have been some of those community-based health reporting monitors throughout the country throughout the life of this pandemic, Garrett.
Yeah, this one, you said this is the one that's the thermostats, right?
I believe so. I'm not familiar with this one that Kristen's talking about in particular, but there's been a couple of these.
Yeah, I'll have to look at this one and because this one, I don't know what it's comparing to. I have to do a little look at this because this one says it's spreading rapidly. I don't really see it that way right now, so I'd have to see what they're doing for their methodology and what they're using as far as the data collection before I can make a determination if it's being used. Now, just because it says critical doesn't mean that it's not worth looking at. Things could still be going down, and this might be a leading indicator. It may be a lagging indicator.
Yeah.
I'm not sure yet. I have to look at it and see what it is.
It's just either way, it's super fascinating how we're able to track these things now and look at data all across the country because of these things. Andrea's writing that State Farm phone number on there. Really important. I'm going to share another phone number too. I think Andrea's replying to somebody who was asking a question before, and she's saying she got an appointment at 1 a.m. So that's very good news that you were able to get in over there. Here's the other number I want to pass along to you if you have questions, COVID-related questions. 1-844-542-8201 is the number that they've been giving us to call over there. I'll say it one more time. 1-844-542-8201. So hopefully that helps some of you get more answers about the vaccine. And hopefully we just get a lot more in and people can start booking once again. It was exciting on that Tuesday morning when everybody was able to start signing up for things. I know it was stressful to so many who were online, including my parents, for a long time trying to get theirs signed up. But it was, at least we were moving forward in all this. Okay, so
I wanted to say one thing really quick.
Yeah.
Amber Lopo is saying they will use data tracing on your phone to see if you were around anyone else who may have been exposed. There actually are apps that do that.
So awesome.
Now, I don't know if Amber's saying this in a way of saying, oh, you're going to do this as a problem, but I'm just letting you know that those apps do exist.
Yeah.
You do have to give them permissions. So we have one in Arizona, in fact, where you can actually sign up. You can put on this app, give it permissions, and then if anyone else with the app that says yes, I have COVID, then it would give you that tracing capability. Now, you have to give it permissions. So that's just so everyone knows. When you look at some of this data collection, especially with these mobilities, this is all anonymized data. But as far as like saying, walking around saying, oh, you got COVID or someone next to you has COVID, there are apps that do that. But again, permissions. So
yeah, Amber stays in the know on all this. So I appreciate her weighing in because yeah, I know that she stays in the know with all that. Okay, so the big thing with this race to get vaccinated is up against the variants. So, we're only as good as we can get vaccinated and get it going when these variants are creeping in and they're showing up more and more. I know we weren't together on Thursday. The South African variant showed up in South Carolina on Thursday. Since then, I believe we had 2 cases in South Carolina at that point. Since then, today, it's reported in Maryland, at least 1 case. So the concern is trying to outpace this with vaccinations. And there are places that they can also track the variants. We were talking about it showing up here in Arizona. Now, that's not the South African one, but it still is important to track. I want to buy you a little time as you pull up that site and mention a couple other changes that are happening right now. Canada is not allowing flights to Mexico or the Caribbean, at least until April 30th. So some changes for our Canadian visitors here in Arizona if you're headed back. Once again, no flights from Mexico or the Caribbean until April 30th out of Canada. And then also Western Australia, boy, they have handled this much differently than we have here in the US. They had 1 case, a security guard at a hotel, and they've gone back into lockdown. So it just shows how different that is, that they're seeing 1 case there and they're like, okay, we haven't seen a case in 10 months, lock it down. Pretty different handling than what we're seeing here in the United States. But wanted to update you on those 2 things. So Garrett, when they want to see the variants and they want to see where those are, I know that the B117, the UK variant, is being tracked on some pretty easy to read sites. Are there other sites that you found that you like, or is that the one that you've been going to just to track that one?
Yeah, I'm looking for the site. For some reason, I'm having trouble finding it. I don't know if they changed the
where it is on there.
They changed where it was. Oh, here it is. Okay. Took me a second. Okay, so the variant tracker is on the CDC. It's very easy to find. Well, no, it's not easy to find.
Not today. On normal days, it is, right?
No, yeah. Well, to be fair, I wasn't looking at my history properly. So, all right. So this is I'm giving producer Carrie the variant tracker. You can see this is what we have so far in the United States. B117 is a UK variant. B135 is the South African variant, and P1 is the Brazilian variant. The difference between these, 467, and again, this is all done with as much science study as they have right now, which means it's 2 weeks. It's behind because that's how science works. They can only study what they can study, and it takes them a while. The UK variant seems to be just more infectious, but the doesn't change. My understanding, and Katie, please correct me if I'm wrong, that the vaccines are still as effective against the UK variant as they are against any standard. There's a billion variants out there. These are just the most emerging ones.
At this point, yes.
Yes. The South African variant does escape some antibodies. It makes it less effective. But they don't know about the transmissibility of the South African variant, if it's higher or not. And then P1 is the one from Brazil, where right now they don't have a lot of data, but they do see that it does escape almost all antibodies and is also more transmissible, is what they think right now. Very, very early emerging data on that. So we don't really know enough about it, but just something to consider.
Yeah, and I noticed they just had the 1 variant that they were tracking publicly on here, and now we have the 2 others added with the case since Thursday in the 2 cases.
Yeah.
And Arizona, then the case in Maryland.
Yeah, Arizona has 3 B117, if you said that or not. I don't remember.
Yeah. So Tina's asking, is the variant in AZ? Yes, the UK variant is in Arizona.
Yes, but the vaccine is as effective against the UK variant now as it was. Now, for the other variants, before anyone starts to panic, both of these vaccines, Pfizer and Moderna, are both designed for boosters in mind, and to redesign what they have to do and ship quickly out. So while at this moment, the Brazilian variant, the P1, the Brazilian variant, as we said, seems to escape almost all the antibodies, and we have been seeing reinfections down there in Brazil from this new variant. That doesn't mean that they are going to be resistant to the vaccine in the future. They could very quickly have this taken care of and have the vaccine as effective against P1 as any. I mean, it's like the flu vaccine. You know,
Yep. Tweaked every year.
Unfortunately, that's what we're dealing with. We're going to have to
Yeah.
deal with this sort of thing where they may have to put out boosters every once in a while to update the vaccine. It's like a software update. How crazy does that sound? But it's like we have to do a firmware update on our vaccine because
yes,
there's another variant out. But that's why they designed it to be able to do that. So that's the good thing.
I'd like to know when I can trade in my iPhone version for the newer version, please, Garrett. Let me know.
Exactly.
Yeah, they're saying that the British version will become the dominant variant in the U.S. very, very soon. So, Tina, hopefully that helps to answer your question. Hence, why the rush to continue these vaccinations.
As the vaccinations, as you said, as vaccinations increase, even though it will become the quote unquote dominant variant, it shouldn't change the trajectory by too much. It may slow the decreases. But as we've seen before, and I know we're running out of time tomorrow, we'll spend time at the ASU Biodesign because they just updated their model. But we'll show you sort of where they think things are going. And by the time we get to the point where the vaccine is actually impacted, it really, the UK numbers for the variant wouldn't really become problematic until we're pretty much at a really good place for vaccinations anyway, as long as we're continuing on the trajectory we're on.
Yeah, Barbara likes your analogy there. people would understand it more. She writes, the software update's a great analogy that more people might understand. It's absolutely true.
It's your antivirus software.
Yeah. Hey, Brenda, the full list of pharmacies is on the AZDHS site right now. There's a lot. Remember, those are for only people who are over 75 at this point. But yeah, the list is on the AZDHS site right there. Okay. So that brings us to the other question some people have been talking about. Are you double masking? Garrett, you're past the. I'm sure you have tons of antibodies right now.
Yeah, I'm in that 1 to 3 month period where I don't really need to double mask at this point. I mean, it's just the way it is. So
yeah, you're feeling better though.
Oh yeah, certainly much better. So if at some point, because as I said, what we know now is the CDC and the World Health Organization believes that antibodies exist for at least 1 to 3 months. That's minimum numbers they're giving. That doesn't mean that it's not going to last longer, but that's what we're at. So I've got 1 to 3 months where I don't have to double mask right now. So
that's the good news. And when we're talking about these variants spreading easier, it's the conversation that's been going around. Are you double masking? Are you not? What are people thinking? And then this conversation that we sort of had last week about the vaccinations. Do you go for speed or do you go for equity? Do you go for greatest risk or the highest number that you can vaccinate? There's a lot of conversation about how you vaccinate efficiently and whether that's getting to the mass population that can get over there.
And one of the problems, as you said, because these vaccines have to be stored, you have to store a certain amount. And if you whatever you release that day has to be used. I know some people are talking about, people cutting in line. Some of that element of cutting in line is because they have to use what they have for that day. But as far as the vaccine is, where was I going with this? I had a point in my mind and now it's gone. So I'm sorry about that.
It's okay.
Sorry.
It's okay. Well, we were just talking about the difference between, serving those who are at the greatest risk versus getting the mass number through.
Yeah. So absolutely. As the balance here is, of course, trying to figure out that population you're at. What's sort of the peak, the summit of that population that's actually going to take the vaccine. First out the gate, I'm not talking about people who just are vehemently anti-vaccine. We're talking about people who are saying, yeah, I'll take the vaccine, but maybe not one of the first people. That's sort of the balance that they have to play with, figuring out who's willing to be sort of first in line for the vaccine. And then who's going to be waiting until, they know exactly what sort of impacts are there. And so while they're that's one of the things, while they're not moving directly into 1C yet, I know some people already asked about 1C, but they have X amount of people that they estimate are in the 1B category. And they have Y number of vaccines that they've administered to the 1B category. And the trick is trying to figure out when you sort of get to that ceiling where it's like, okay, now it's time to open it up to a much larger population because the 1C is a much larger population and it's going to be even more logistics for the 1C than we are even seeing at 1B. I mean, if you think getting a point right now for 1B is crazy, just wait till we get to 1C. I mean, it's going to be insanity there just as far as the number of people that are in 1C.
Yeah, and that sort of brings us to the other conversation that's been happening. Because they sort of changed the rules and said, we want to do everybody 65 plus and bump them up, not just 75 plus. That sort of changed things for a lot of essential workers. And a lot of those essential workers are also people of color who are disproportionately affected by this pandemic. And so really, again, that speed versus equity conversation comes up, and it's going to be something that's going to be discussed for a long time to come as they look at how effective states were in this vaccine rollout, how other countries were in this vaccine rollout, and how things look overall in this case. Let's see. So many. Oh, look at all these comments. I'm scared. I'm scared 1C and phase 2 are going to be like the Hunger Games to get a vaccine. Yeah, Candace. Hopefully they have just a huge number of vaccines in, so that before they open that up, there's a little bit of rhyme or reason, because you're absolutely right in that concern. Okay, we didn't get to the zip codes, and we're pretty much out of time, Garrett. So I'm hoping that
we'll do zip codes and forecasting tomorrow. So.
We can promise that for tomorrow, and keep everybody updated. We'll be back here with you tomorrow. It'll be our only other update for the week, unfortunately, because of some other assignments. So make sure you join us tomorrow. We'll do the same time, same place, all that. In the meantime, be safe out there, and you can find all of our coronavirus reporting at abc15.com/coronavirus. And you can find Garrett on Twitter at Garrett_Archer. I'm on Twitter at Katie Rammel. And you can also find me on Facebook at facebook.com/news from Katie. I want to thank all of you who have been awesome in the comments today. Thank you so much. I know we were off to a really rough start with some of the comments and some of the things, unfortunately, that were said to us in the beginning. And I just want to thank you for all the kind comments, because it means so much, and it's the reason why we continue to keep you guys updated on this, so that you can make the best choices for your family and your life. We're going to invite you back here tomorrow again, same time, same place. Be safe out there.